Hello, Brazil. This is Dra.Sonia Michail. I'm a pediatric gastroenterologist from Los Angeles here in Orlando for the Digestive Disease Week. And we just got done with a session that I was co-chairing. It's about pediatric gastroenterology, microbiota, probiotics, and prebiotics. So this session, I would like to summarize the 5 studies that were presented today. There were 2 studies related to probiotics, and they both appeared very promising for treatment of necrotizing enterocolitis in infants. They were both animal studies. The first study was about Lactobacillus reuteri, DSM 17938, which actually changed the inflammatory profile of the inflammation necrotizing enterocolitis. The other study looked at the conditioned media, so not just the probiotic, but the media that was the probiotic was grown in, and it showed that it reversed pretty much the effect of the Chronobacter sakazaki, which induced necrotizing enterocolitis. There was an interesting study as well with Helicobacter pylori infection and a factor in aging, and it appears to make the stomach age by about 30 years when you have Helicobacter pylori infection. They looked at endemic versus non-endemic areas of the U.S. There was also an interesting study from France, from Paris, about low doses of chloropyrifos. Apparently that's an insecticide that is used for vegetables and fruits, and it seems to affect the intestine, affect the growing pups, and they were actually given during pregnancy of the pups, and it affected some of their intestine parameters and their weight. And then the last study looked at the emerging role of fecal microbiota therapy or fecal transplant in the treatment of Clostridium difficile. They had 3 children, and they showed a change in the microbiota. The diversity improved in those patients, and they compared the donor microbiota to the before and after the transplant, and it seems like the patients that received the transplant, their microbiota became similar to the donor, and they were mostly mothers. So very interesting studies, and hello, Brazil.